All set.
Hello, everyone. Welcome to the introductory webinar for the Autism Intervention Research Network for Physical Health, the AIRP. My name is Keisha Rosenau, and I'm a developmental researcher at UCLA and a project scientist on the AIRP. We are beyond excited to share our vision for the AIRP with all of you, and I would like to thank all of you for joining us today. So before we begin, I'd like to address a few logistical details. We will provide brief introductions for each of our speakers, and we will also reserve time to answer questions at the end of the presentation. Because of the number of participants, your audio will be muted throughout the call. However, you can submit questions at any point during the presentation via the chat box on your webinar console. This entire webinar is being recorded and will be available on the AIRP website in the near future. There will also be a short evaluation survey at the close of the webinar. We invite you to provide feedback on this webinar and also to provide suggestions for future webinars, as the AIRP will be hosting monthly webinars beginning in January. So this is the first of many. In the interest of time, let's get started. It is my honor to introduce the Executive Director of the Association of University Centers on Disabilities, Mr. John Cheetah.
Keisha, thanks. And thanks to all of you for joining us today for this introductory webinar. AUCD is thrilled to be partnering with UCLA and more than a dozen other AUCD network members on this AIRP grant. We are excited to see the research that will be produced, the collaborations that will result from it, and ultimately the benefit that it will do for the broader scientific and disability communities. It's my honor to now introduce our funder for this project, and thank you to HRSA for funding this. Laura Kavanaugh, the Deputy Associate Administrator at Maternal and Child Health Bureau at HRSA. They've been great partners, and we look forward to working with them on this project. So Laura, take it away.
Thank you so much, John. It's such a pleasure to be with you. Good afternoon or good morning. As John mentioned, I'm Laura Kavanaugh, and I'm the Deputy for the Maternal and Child Health Bureau at the Health Resources and Services Administration. First, before we get started, I'd like to introduce and acknowledge your project officers for this research network, Dr. Jessica DeBerry and Dr. Dana Foney. Foremost, congratulations on successfully competing for the Autism Intervention on Physical Health Airp Research Award. I want to really thank you for your commitment to moving the field forward. I'm going to tell you a little bit about the history and background of our agency, put a little context around where this research network sits within our agency, and what I hope we will achieve together in the coming years through this research network. As you may know, HRSA is the primary federal agency to improve healthcare for geographically isolated, economically, or medically vulnerable populations. The Maternal and Child Health Bureau's mission is to improve the health and the well-being of America's mothers, children, and families. In fiscal year 2019, the MCH Services Block Grant, which is the public health care system for the maternal and child health population in the United States, served an estimated 60 million women, infants, and children, including children with special health care needs. That included 92% of all pregnant women, 98% of infants, and 60% of children nationwide. Our programs rely heavily upon evidence-based strategies and are data-driven, and your research is what makes the difference and the critical contribution to that evidence base. The Airp is funded through our Division of Research in our Office of Epidemiology and Research within the Maternal and Child Health Bureau. The MCH research programs inform practitioners, the scientific community, as well as the general public. The Division of Research administers 4 broad grant competitions. These include the first, which you're a part of, the Research Network program. The second is a field-initiated innovative research studies program, which we call the FIRST grants. Next is a secondary data analysis research studies program, known as our SSTAR grants. And finally, single investigator innovation program, or SIP. Roughly half of our research portfolio focuses on a broad maternal and child health emphasis, and the other half is specifically focused on autism. The Airp Research Network falls in the Autism Research Network grant competition, and it's our largest research network investment at $3 million per year. The Maternal and Child Health Research Network program has contributed to improving the lives and the health of mothers and children by collectively enrolling approximately 10.1 million participants in 250 research studies, publishing over 1,100 peer-reviewed publications, developing and distributing 281 clinical guidelines, tools, and toolkits to service providers and families, and leveraging over 116 external grants. I encourage you to familiarize yourself, if you're not already familiar, with the other autism research investments that are part of your family of research programs within the Maternal and Child Health Bureau. There's the Autism Intervention Research Network on Behavioral Health, Airp, the Developmental Behavioral Pediatrics Research Network, or DBPNet, the Healthy Weight Research Network, Autism Longitudinal Data Project, and the Autism Transitions Research Project. As you will be hearing in much greater detail shortly, the purpose of Airp is to establish and maintain an interdisciplinary, multi-center research forum for scientific collaboration and to have a shared infrastructure to build upon. This research network will provide national leadership in research to advance the evidence base on effective interventions for children and adolescents with autism spectrum disorder and other developmental disabilities, with a particular focus on addressing physical health and well-being across the lifespan. Thank you so much. And again, congratulations on the award. And we really look forward to learning more about the great work of this research network. Take good care.
Thank you, Mr. Cheetah and Ms. Kavanaugh. Next, I am pleased to introduce the principal investigator and the director of the AARP, Dr. Alice Kuo. Dr. Kuo is a professor and the chief of medicine pediatrics at UCLA and the director of the UC Len program. So please welcome Dr. Kuo.
Thank you so much. I am so excited to be able to share with you our vision for the ARP. As Laura mentioned, this is one of the investments of the Maternal and Child Health Bureau focused on autism. For our particular project, the ARP, our hope is to establish and maintain this interdisciplinary multi-center research forum in order to address physical health related questions that impact autistic individuals. We hope to provide national leadership in research in this area and to spur on more investigators to join our efforts. And I want to go over a lot of the ideas that we've had for how to do this. Our overall goal is to develop effective interventions for autistic individuals with a focus on addressing their physical health and well-being across the lifespan. Next slide, please. So this is the structure that we've set up so far. We were awarded at the beginning of September, so we've been quite busy over the last 3 months. At UCLA is our National Coordinating Center. This is really the administrative core or the hub that is overseeing the development of all the different little components in the network. The National Coordinating Center comprises of myself, Keisha, Dr. Emily Hotez, who you'll be hearing from a little bit later on, and a small staff to help us with website development, communications, and so on. Our partnership with AUCD is an extremely important component of ARP, and we're building upon their networks of over 133 university centers that have either a LEN program, a USED, or an IDDRC. I know that's a lot of alphabet soup, but these are basically university efforts to address either training of professionals in neurodevelopmental disabilities, advocacy efforts, policy efforts, as well as basic science research in the IDDRCs. And so with that existing network, we're hoping to leverage those relationships and introduce this field of ARP more broadly. The other thing, so network management is one component that AUCD is doing for the ARP. And the second is the data repository. So many of us who have been funded on either a LEND, IDDRC, or USAID project is aware of NIRS, which is the National Information and Reporting System that has been set up by AUCD to help with collecting data for reporting purposes to the federal government. And what our vision has been for ARP is to develop an analogous reporting and information system for research. So one thing that NIRS does not do right now is capture research information. And we have been in many conversations over the past month with data experts and security and compliance experts, because research information is maybe a higher bar, especially if we're talking about protected health information. And we've been trying to figure out how to create this platform that would make it easier for researchers to not only collect data for their studies, but then also have that data be able to be combined. So for purposes of additional analyses, we're also looking at supporting with some of our efforts, genetic syndromes and the desire of families who have children with rare diseases or orphan syndromes to create registries. So we're looking at having the ability to do that as well through these powerful data structures. So that's one component of ARP. The second, which I'm very proud of, is the Autistic Researcher Review Board. We have a couple of members from that board who will be giving a presentation and explaining what they do. I have found them extremely powerful and important collaborators in this effort. And already in the short time that we've been working together, I have learned so much. So I'm excited for you to learn also the part that they play in the ARP in the next presentation. The third component of the ARP are the research nodes, and we identified 6 research nodes, which I'll go over on the next slide. These research nodes developed during our proposal process as a result of pretty significant literature reviews and expert interviews to identify what were the priorities regarding physical health of autistic individuals. And the leaders of those research nodes comprise our steering committee. And these investigators are really trying to guide the direction that the ARP is headed. I will say that through a research agenda, a national research agenda for ARP, our hope is that the agenda is fluid and dynamic and can modify over time based on the direction that research goes. And so I guess we will hear a little bit more about that later on in the presentation. But the main point that I'd like to make is to say that this is an iterative process, and we welcome input from members of the network, the entire network, which includes all of the attendees on the webinar today and anyone listening. And so we really do want to hear from a diverse group of stakeholders and opinions on where research on physical health for autism should go. And then finally, our fourth component are the collaborating research entities. These are members of the existing AUCD network that have made a commitment to helping us get started. And so these 15 research centers, university research centers, are giving us input already and meeting on a regular basis and forming committees that others can join. So there's a lot of interest and activity going on in that component as well. And so with those 4 components and a national coordinating center, our goal is to accomplish the 3 bullet points in the orange box. And so those include launching an ARP Scholars Program. As I mentioned, we would really love to focus our energies on cultivating new investigators in this field. This includes doctoral students, postdoctoral fellows, and junior faculty, along with existing researchers who may be pivoting or developing a new interest in physical health. So all of those investigators can come together in our scholars program and network with each other. In the scholars program, we hope to be able to fund with some pilot and feasibility funds, some pilot studies so that they can lead to bigger awards, as well as identify mentors, not only in the scholars' own institution, but throughout our entire network, because this is a newer field and not every institution may have researchers who are doing research on physical health for autism. And once we have our scholars, we need opportunities for them to present their work. And so we are hoping to develop ARP research days in conjunction with the AUCD annual meeting in the winter in November, December, and also the annual HRSA Cares Conference, which is typically every summer. And so with an additional research day that is focused on physical health in autism, then investigators will have an opportunity to present their work and to spur on conversations and collaboration. And then finally, as a place to publish their work, we are planning for annual supplements in the journal Pediatrics, as the ARP previously have done in the past. Our goal is to produce a supplement every year with 15 or so research articles, and the presentations from these research days and the work from the ARP scholars will have an outlet to be able to disseminate this, their projects to others. Next slide, please. So these are the research nodes that we determined through our proposal process, and I'll just speak briefly on each one. In the previous work that I did as the director of the Healthcare Transitions Research Network for Autism, we had conducted a number of stakeholder interviews trying to identify what were the issues facing youth and young adults with autism, and what their families were facing when it came to their physical health care. And the number one thing they identified was finding a good primary care provider. And so we recognize that primary care is an important aspect to addressing the physical health of everyone, and that much work can be done in primary care to improve the patient experience of care, as well as making sure that the quality of primary care is appropriate, that patients receive all of the appropriate, routine health recommended services, so cancer screening, immunizations, those types of services. And so that I'm actually leading that node as a primary care provider myself, with a background in health services. And so those are the types of projects that we're looking for in that node. The second node is the community-based lifestyle interventions node. And when it comes to physical health of everyone, many lifestyle behaviors can affect our cardiovascular and cancer risk. So for example, nutrition, physical activity, stress reduction, sleep quality, those are all lifestyle behaviors that impact our physical health. And so that node is going to be looking at programs and interventions that can help autistic individuals improve their health, their physical health status. The sexual and reproductive health node, I think, is a very exciting one because there has been a paucity of research in this area, and it is very important to autistic individuals. Not only sexual education and traditional sort of sexual health issues such as contraceptions and screening for sexually transmitted infections, but also sexual and gender identity pregnancy and women's health issues, I think have intersectionality with autism. And so more research is needed in this area to improve the experience of pregnancy for autistic females and to address many of these issues. The fourth node of healthcare transitions is pretty standard and has been identified as an opportunity to ensure that autistic individuals over the lifespan have a good start into having good health as an adult. And so typically autism has been considered a pediatric condition because it's developmental, but we recognize that autistic children turn into autistic adults, and that the transition of the systems in between the two systems can be somewhat difficult. For many autistic children and their family, there is this reference to a service cliff where because so many of the services are wrapped into K through 12 education and special education services, that in adulthood, there's no analogous structure. And so families sometimes are a little bit at a loss as how to navigate that transition into adulthood. And so care coordination, thinking about post-secondary education and employment, and then the benefits, the public benefits that can be available are all areas that are important and need additional research to understand how we can better address these issues. In the neurology node, I think this is very firmly physical health. I think not that autistic individuals sometimes have co-occurring neurological conditions such as seizures. Dr. Wilson is also very interested in the neuromuscular issues, so fine motor, gross motor development as well. And so she is leading up that node to look at these maybe a little more typical comorbidities or co-occurring conditions that are associated with autism. And finally, our genetics node, I think, is very exciting. Dr. Julian Martinez leads that one. I had made some reference to rare and orphan diseases. There is, as more genetic research is done, there is identification of more and more conditions, and families needing to connect with other families for support and also to spur on more research in those particular conditions, but also just the value of genetic screening and identification of additional genetic risks that are associated with certain mutations and so on and so forth. And so there's a lot of need for more work in that area. And we're working on this node very closely with the Autistic Researchers Review Board to make sure that the research in this genetics node is done in a very ethical way that addresses the concerns that many autistic individuals have. Next slide, please. And so I just wanted to go through our vision for the research engine. I know that I have just a few minutes left. This is the main piece of it, which is that a research study would go from step 1 to step 5 through all the different components that we're building. The proposal can come from anyone throughout the network, and we will help to package that proposal into an implementable study. And that data collection can be also from anywhere in the network. Next slide, please. So when someone submits a proposal, it would go under 3 reviews: an administrative review by us at UCLA, just to make sure all the pieces are there, a content review by the steering committee, and a review by the Autistic Researchers Review Board to ensure that the study is of relevance to autistic individuals. Next slide, please. The package includes creating things like an IRB template, research protocols, data collection, survey methods, things like that. And the package would then be uploaded into this electronic platform that we're creating at AUCD. Next slide, please. when the package is uploaded, then any network member who wants to participate in that particular study is able to then download the package and then start data collection in their site. The idea is that, for example, if you are a new investigator, and I'll just pick a random place at Washington University in St. Louis, just as an example. If you're a young investigator there or a new investigator there, and you want to collect data on 100 autistic patients with a particular focus, it would be harder to collect data in one site to try to identify 100 autistic patients who fulfill a particular criteria. But across our entire network of 133 research centers, maybe 20 research centers are interested in the same particular study, and each one would only have to recruit 5 autistic patients. And then the new investigator in Washington University could compile all that data for their analyses. So this is meant, we're building the infrastructure that would make that kind of data collection possible. Next slide, please. Then the researcher gets their data and can analyze it, can create presentations for our research days or any national conference or any research conference, and then also publications for our supplement or any journal. Next slide, please. So this basically sums it up, the finding, presenting, and publishing. And so this is the engine that we are in the process of creating. I hope to accomplish this. We are all working very diligently on this, and hope to have this in place, many big pieces of it, by the summer. Next slide, please. So basically anyone can join us. I think that's the main message that I want to say is we value your input. There will be opportunities for network members to get involved through our committees and through the CREs. We're especially interested in supporting, as I mentioned, the new investigators, and autistic researchers and individuals are encouraged to join us. Thank you very much. And without further ado, I'm so excited to introduce 2 of the members of our Autistic Researcher Review Board, Jackie Ryan and Patrick Dwyer. I will just say that I have really enjoyed working with them over the past 3 months and look forward to a long collaborative effort here. So take it away, Jackie and Patrick.
Thank you, Alice. Today, Patrick and I are going to talk to you about the Autism, or the Autistic Researcher Review Board, and our role in the Airp. And I want to first acknowledge the other members of this board: Heather Brown, Dina Gasner, Stephen Kapp, Ari Neiman, T.C. Weissman, and Zach Williams. Next slide, please. So we are all autistic researchers at various points in our careers. Some of us are grad students, while others are professors and lecturers. And we are an international group. There's a few of us in Canada, all across the United States, and we have 1 member in the UK as well. We bring unique perspectives to this work as researchers and as having lived experience as autistic people. We recognize that we have privilege as researchers and that we don't represent all autistic people. And this is one of the reasons why we encourage collaborations and participatory autism research. Next slide, please. So one of our values and the perspective that we take is neurodiversity. And quite simply put, neurodiversity means that all brains are different. However, we also use the term to denote a political movement that opposes cures and normalization for autism. Instead, we advocate for acceptance, supports, respect for autistic people's own goals, and promotion of quality of life. The neurodiversity movement is not just about autism. It includes all neuro minorities, such as ADHD and those with learning disabilities. We also desire to learn adaptive skills to help improve our well-being. So we're not just completely against any intervention. And of course, we want our co-occurring medical issues such as epilepsy and GI issues to be treated. Next. We are evaluating many of the projects as we're reviewing them in terms of does it improve well-being for autistic individuals? And so we were looking at what do we mean by well-being? And since it's subjective and dependent on the individual, we have adopted this model, Seligman's 5 pillars of well-being, that we're going to use to evaluate projects. So we recognize that well-being may mean different things to autistic people than it does to non-autistic people, and also that it's going to mean different things to different autistic people. And so the 5 pillars are the positive emotions, engagement, positive relationships, meaning, and accomplishment. Next, please. So as a group, we've identified some research priorities. We're very interested in intersectionality, growing into adulthood and then aging, which is a very under-researched area. And then we're also really interested in looking at systemic barriers for individuals with autism in terms of accessing the medical system, medical care. And then we're looking to understand not just that there are co-occurrences, but looking at what contributes and how we can improve things at multiple levels, including at the individual patient, the provider, the system, and population levels.
And we've identified a number of specific primary goals for our review board. And Jackie, of course, has already, I think, covered that first primary goal there of promoting autistic people's health and well-being. We also want to promote an evidence base that's scientifically rigorous. And of course, that evidence base should also be inclusive of all the heterogeneity that we find in autism, the identities that intersect with it, and be sensitive to what the community actually needs. And we're also really excited by everything that the Airp is doing, adopting the neurodiversity approach, forming our review board, and we're really hopeful that these innovative practices could actually be models and inspiration for other research networks and research organizations. Next slide, please. And another primary goal for us is ensuring that results of Airp research are communicated in a way that is both respectful and accessible to the community. So in addition to dusty journal articles, we really want to encourage people to try using additional media and formats. So for example, there's some great guidelines about how to write a good lay summary in the author instructions for the journal Autism in Adulthood. We can use video presentations to reach people, or perhaps even better, adopt a less lecture style and have video discussions and interviews. There's many, many different possibilities here about whichever possibilities we're using, and also in journal articles. It's important to use language that is appropriate and respectful, obviously. It is true that not all autistic individuals agree about what constitutes appropriate terminology, but it's still usually possible to show that we're making a serious effort to be respectful and sensitive. And it's important to bear in mind here, I think, that just because something is in the DSM that does not necessarily mean that it is the objective correct terminology to use. And in fact, this is my personal opinion. I think a lot of the terminology that's in the DSM is kind of value-laden and unscientific. And that often adopting alternatives like disability instead of disorder is, more neutral and appropriate. And next slide, please. And our last primary goal is that we really want to foster collaborations between different Airp sites and projects and nodes and autistic people and community stakeholders beyond our review board. Because as Jackie was mentioning earlier, we do recognize that our academic perspective makes us fairly privileged, and of course, it's better to have more community collaboration than less. For example, in the area of information and training intervention, specifically in a post-secondary context, it's actually been found that developing these information and training resources in a way that is participatory, that includes these community perspectives, makes them more effective. And I'm sure that you would see similar things in a lot of other domains. So we do want to encourage these collaborations. And if there are barriers that people are encountering, we would encourage them to let us know what those barriers are so that we can work to further encourage those collaborations. Next slide, please. On that note, we'll just very quickly run over some key points about engaging with the community in research. There's a number of different approaches that you can use to do this. Community-based participatory research is a very demanding but very, very cool approach in which community collaborators are equal partners with the academic researchers from the very beginning to the very end of the project. Now, we do recognize, as I said, that this is a more demanding approach, might not be feasible or appropriate all the time, but there's also other approaches like stakeholder engagement, community advisory boards, and other models. Whatever people do end up deciding to use, if they want to, collaborate with the community, we would encourage them to be transparent about that when they're recruiting community collaborators to prevent misunderstandings or false expectations, and of course to be transparent about that with our review boards. Next slide, please. There's some really wonderful guidelines about collaborating with the community that were published by Christina Nicolaitis and colleagues last year, the Aspire guidelines for including autistic adults as co-researchers. And actually a lot of what we're saying right now is taken pretty much directly from those guidelines. So I highly encourage people to look up those guidelines and read them more thoroughly. Some key points, it's important to consider compensation. If the academic researchers are getting something out of the project, well, the community collaborators should be as well. Accessibility, is there going to be some kind of research meeting? If so, you probably don't want to expect people to be able to naturally navigate to a pause in a conversation, think on their feet, and interject comments verbally. It's better to have multiple modalities for participation. Communicating in a clear way, so not using jargon. There's all sorts of accessibility considerations, and there should really be an ongoing assessment of what's needed and changes as necessary to ensure accessibility. And then this point here about trust is not necessarily the most pleasant point, but unfortunately, because autistic people and other community stakeholders have been somewhat marginalized from research, and many are concerned that research has actually done things that have perhaps harmed the community. There's a lot of bitterness and frustration. And so it's incumbent on us as academic researchers to actively work to build and maintain trust. And for example, if we do run into problems and disagreement, not jumping to explanations like, oh, it's the autistic black and white thinking, but bearing in mind these complex and fraught issues and thinking about what we could do, being mindful of those to address the problem. Next slide, please. And then, of course, one really important consideration if you want to collaborate with the community is who are you wanting to collaborate with specifically? What are the appropriate people from the community for your project? So I'll mention one relevant anecdote, which is that when I was initially approached about perhaps joining what became the Autistic Researcher Review Board, I was a bit concerned because my physical health is quite good, and I wonder, do I have lived experience that would be relevant to this network? And eventually it became clear that for the Autistic Researcher Review Board, it was the research experience that was key. But I wouldn't really be an ideal fit if it was lived experience of physical health that was important. So it's important to consider what specific kind of lived experience you need for your study. And I'm going to turn things back over to Jackie here.
Questions around representation are of great interest to me. And we've put some situations here where we need to think about, who do we need representation from? And I think it's probably best determined by what your research question is. And also then a need to get sort of a broad base of diversity of experience. And a couple of areas that tend to come up, certainly within my sphere of experience. What about non-speaking people who don't communicate fluently? So should they be represented by their caregivers, or should they be represented by other non-speaking autistic people? Or do we need to figure out how they can represent themselves using some novel methods, like photo voice or arts-based methods? And then autistic children, and simply, even when you're involving children in any research, the same questions come up. Should they be represented by their caregivers, parents, guardians, or by autistic adults? Or can they represent themselves? And as I mentioned, I think that's best determined by what the research question is. Next, please. Next slide. And so just in conclusion, we are really excited that the Airp has included an Autistic Researchers Review Board. We think that this will be an exemplar for other autism research networks. And I'd just like to share a little bit about my personal experience so far, that I found it to be one of authentic inclusion, not tokenism. I've observed that each node is genuinely interested in learning from us to ensure that their research, practice, and language all reflects respect for autistic people. Thank you.
Thank you very much, Patrick and Jackie. Even in the short 3 months that since the ARP began, the ARRB has been very active and has been a great experience as we learn from each other. So finally, we have Dr. Emily Hotez, who will present on the AIRP Scholars Program. Dr. Hotez is faculty in the Department of Medicine at UCLA and a project scientist on the AIRP. So please welcome Dr. Hotez.
Thank you so much, Keisha. Today, I will speak to you about the AIRP Pilot and Feasibility Program and corresponding Scholars Program. So the AIRP will support a Scholars Program beginning in 2021 and lasting throughout the duration of the grant. The overarching goal of this work is to launch and support the next generation of researchers seeking to promote the health and well-being of autistic individuals across the lifespan. Through the Scholars Program, we will seek to do the following. First, we will seek to provide pilot and feasibility funding for research projects. These are research projects that may set the stage for applying for larger external funding. These funds may also be used to conduct research that will inform the development of a larger scale intervention research project in the future. Second, we will seek to provide opportunities for mentorship, training, and professional development. And really beginning at the proposal writing stage, we knew we wanted to develop a research network that would provide an infrastructure for training and professional development, particularly for new or early investigators, just as Dr. Kuo mentioned. And our hope is that the Scholars Program will be a mechanism for accomplishing this. And finally, we really hope the Scholars Program can facilitate network collaboration by providing an opportunity for grantees to collaborate with researchers and stakeholders across the network, including the Autistic Researcher Review Board. Next slide, please. So the Scholars Program is open to any early investigator, as well as any investigator at any stage in their career who is interested in transitioning into research on autism and physical health. As Dr. Cole mentioned, this very much comports with our interest in being very inclusive in our network. Next slide, please. So the Pilot and Feasibility Fund program will provide an opportunity for grantees to apply for any amount of funding under $25,000. These funds are meant to support 1 year of research activities. The idea is that applicants will apply with their faculty mentor, who will agree to provide mentorship and guidance for their project. All mentors will meet approximately twice a year with the AARP steering committee and other partners to brainstorm opportunities to facilitate the continued development of the scholars who are in the program. All scholars will present their findings at research days, contribute to AARP supplements in pediatrics, and engage in other network activities. Next slide, please. Our plan is to disseminate a formal RFP in January, so there will certainly be more information to come on the criteria that we will use to evaluate applications. But here are some examples of some criteria that we will use to evaluate incoming proposals. So first, significance and merit. Does the research have significant potential to address a gap in knowledge in autism and physical health? And of course, does the proposed research align with the goals of the AARP and the Autistic Researcher Review Board? We'll also look at methodology and approach. So these again are pilot funds. Is the project likely to be accomplished in 12 months? And are the study concept and design appropriate for a pilot and feasibility study? And finally, we'll look at investigator qualifications. So are the PI and other key personnel adequately trained and qualified to carry out the project? And we'll also look at whether there is an appropriate plan for supervision from the mentor. Next slide, please. Here's our proposed timeline for the rollout of the AIRP Pilot and Feasibility Funds and Scholars Program. So we will plan to disseminate the RFP in January. Potential grantees will apply by March. All applications will be reviewed by the National Coordinating Center, followed by the Autistic Researcher Review Board, and then the steering committee, and that will take place from March through May. We'll then send funding notifications by June with the goal of disseminating funds to be available for use beginning in September. Next slide, please. Thank you so much. We do have some time for questions and answers. Feel free to type any additional questions in the chat box and we can read them aloud for the presenters. I'll also be posting a feedback survey link into the chat, and we would greatly appreciate any feedback that you can provide via this survey. So thank you again, and we look forward to your questions.
So I see one question from Mia Sato about how long the ARP funding project grant lasts. I'm not sure if it means our entire ARP or the small grant, the pilot and feasibility fund. Our funding is for 5 years. So we just started September 1 of 2020, and it goes until August 31, 2025. While we're waiting for questions to come in, I also wanted to acknowledge the members of the steering committee. I didn't name them all. So I had mentioned that I'm the head of the primary care health services node. The community-based lifestyle interventions node is headed up by Doctors Priyanka Fernandez and Candice Grignani at UCLA. The sexual and reproductive health nodes are headed up by Doctors Lisa Crowan and Maria Masolo at Kaiser Permanente, Northern California. And the healthcare transitions node is headed up by Doctors Lindsay Shea at Drexel, the AJ Autism Institute at Drexel University, and Paul Shattuck at Mathematica. The genetics node is headed up by Dr. Julian Martinez at UCLA, and the neurology node is also headed up by Dr. Rajuda Bott Wilson, also at UCLA.
We have a couple of questions that have come in. Brian Bay, I think is correct. So Brian asks, autism work, in quotes, in my opinion, is community work. Does AARP allow for other than just ASD folks? By allow, I'm asking, does the funding and implementation foster research that involves related community folks besides the one with autism and the primary care provider?
So if I can understand the question better, is this about like community engagement, like from a public health perspective, or so I guess the community-based lifestyles intervention node will look at intervention both at the individual level as well as at the community level. So for example, you know, an example could be implementing some sort of parks-based intervention that could increase physical activity for autistic children, you know, through a recreation program or something like that. I'm just trying to understand, Keisha, do you research that involves related?
It sounds like perhaps one other component of that question might be, are we including other community stakeholders who are relevant for the lives of autistic individuals? And we certainly are. So a lot of our research, as you cited in your question, Brian, we will be looking at primary care providers and other medical providers, as well as families and other stakeholders, recognizing that physical health in autism doesn't occur in a vacuum, and we want to make sure that we are accounting for those community level factors. That's a great question.
Right. So
we
for
do have another question in the chat. My question is whether cause of and interventions for GI symptoms / disorders are considered to fall under one of the priority research areas.
So I think currently where I would say if you have if you are interested, if one is interested in research on gastrointestinal issues, the first node is primary care and health services. So in this case, we would be looking at referrals to you know, gastroenterology specialists, or there is some work being done around mind-body interactions, and so sort of the microbiome and sort of the gut and that kind of thing. So those could fall in the primary care health services node. I think this would be an area that we would have to see if there is a lot of need, and you know, I would not rule out the possibility of the development of a future node. For example, if there was to be more need and attention paid to this area, that we could, you know, go through that process and see if we would create a node for that. For now, I would say that it falls under health services, so we would be looking at placing a study related to that in the first node.
Somebody else asked a question about, is this in written format? Great question. We actually are completing the submission of our first supplement right now. So even though we started in September, so it's only been a few short months, which have really, really flown by. We've extensively described the research engine, the network, the model, more objectives for each one of the nodes, all within that information. And then also we're putting the finishing touches on the AARP public-facing website right now. So that will also be up shortly.
And then as far as the listserv, AUCD, and Dawn could probably speak to this, AUCD has started to set up listservs like for our steering committee and our CREs as well. And we could definitely create one for the entire network around ARP. I think we need to think about how people would subscribe to that, who that would include, but we're absolutely open to increasing communication with the entire network about what our activities are and all the different opportunities that people have to get involved.
And I'm also seeing a question in the Q&A about resources relating to terminology. Yes, we're actually quite interested in that and thinking about adding something about that to the supplement. But in the meantime, I can definitely recommend some articles, and I'll pop some DOIs into the Q&A box in just a second.
And then we've got one other question. Would orthopedic studies also be placed under the first node or other? I have observed orthopedic spine issues more than once in autistic individuals who have communication issues from seizures with late evaluation and treatment due to communication issues. Is anyone studying anything in this realm?
I'm not aware of anyone studying this particular issue. However, to the broader question of where orthopedic studies would be placed, I agree that, I kind of think it could be in the first node or it could be in the neurology node, because there is so much of orthopedic issues that overlap with neurology. So oftentimes in our clinical services, the orthopedics and neurology service lines are combined. And so I think this question to me harkens to, would there be perhaps collaborations between nodes, right? And so I think it depends. If the issue is more related to, for example, the actual orthopedic issue, the biology of it, the pathophysiology of what is causing the challenge, then maybe that is more appropriately placed in the neurology node. If the issue is how do people access that service, how do they get connected to that treatment, then maybe that's where it overlaps with our first node. So the nodes were not meant to be exclusive. It was really just a way to start to organize some of the work so that we could, support studies appropriately and adequately. And we have talked about collaborations in between nodes. And to be honest, if there are issues that don't fit neatly within a node, I think that is, a conversation that we're going to have to figure out how things are organized. And it could be that there are some studies that don't fall neatly or conveniently into a node, but that we would still support.
So it looks like we just have another minute or so left. If anybody has any last minute questions, I think Dr. Hote has dropped the feedback survey link into the chat again. And then also, if you want, you can hold up your camera screen and the QR code, then it will pop up for you on your phone if that's easier. And thank you for all of the positive feedback and for all of the questions as well. looks like we're right at time. So we will end the call now. But again, I just want to thank everybody for attending the webinar. The webinar has been recorded and it will be archived on the AIRP website in the future. Please take a few moments to complete our survey because we really want to hear from you. What do you want to hear more about from us? So as I said, we're going to be doing monthly webinars. And so we'd love to hear more about the topics and things that you all would love to hear. So thank you everyone, to our panelists and also to all of the participants, and have a good day.